Well, now I'm here. I'm back as promised. Yeah, I'm a little hungover and I don't even drink. So that's how wild the party was yesterday. But you're here to pass an NCLEX. And so today we're talking about the Ngn Nclex test plan. And specifically for those of you who already failed, we're talking about how to understand your CPR report. So if you're planning to take a test and you never failed and you want to understand what in the world is the test plan that I should be studying for and what kind of resources can I use to do that, this video is for you. On the other hand, if you've already failed and you kind of didn't pay attention to the candidate report, you might want to go get it because I'm going to help you understand how to analyze your CPR report. What the hell does it all mean? Because frankly, if you read it, it doesn't make sense. Yeah, if you read the CPR report, it's almost like they chose to use German language to explain it because that's how confusing those words are. So part of my job is to make it plain, okay? So if you're ready, I'm ready. Let's get started. Now, first things first, when you look at the NGN test plan, remember that it's based on 2023's changes to NCLEX. So when you're looking at the test plan, yeah, there have been a couple things that changed. I want you to keep in mind that the number of questions is now 85 to 150. You get partial credit for select alls and case studies and a bunch of other bow tie questions or whatever. So you do get partial credit. They have added more pharmacology. They have also added more infectious diseases. And so that's important for you to remember. As I look at the Ngn Nclex and compare it to the old test and what students are doing wrong, I see that a lot of students still failed the basic care and comfort that used to be the #1 area of failure for the old test. But with this new test, I've noticed that actually reduction of risk is a huge failure area, and it's almost like taking over as #1. If in the very least, it's at least tying basic care and comfort for #1 area of failure. So those are some tips for you. Now, if we look at the NGN test plan, the first category that you need to know, you need to study for is management of care. And frankly, that's a vague term. I could sum it up this way. It has almost nothing to do with the basic care and hands-on care of a patient, and it has everything to do with management. So in the management of care, you're going to see questions that ask you about ethical legal concepts. You're going to see malpractice questions. You're going to see ethical dilemmas. You're going to see violations of patients' rights. You're going to see informed consent. You're going to see patient advocacy. You're going to see your advanced directives. You're going to see DNRs. You're going to see organ transplant concepts that have to do with healthcare proxy. You're going to see information that you need to really understand about what your patient wants as they enter into death, right? Okay, you're also going to want to remember how to delegate in management of care. You have to know prioritization and delegation and even supervision. You have to understand how to make assignments. You have to know the different roles of each nurse, the charge nurse, what's our scope of practice, how do we make sure we don't go out of our scope even when a manager asks us. We have to know how to handle workplace conflict with staff, or even conflict just on the unit with patients. We have to know how to appropriately put roommates together. So this is all your management of care. And so this is actually a big part of your test. I put on the side of each category about the average percent of what this makes up your test, of how much of this makes up your test. So this is about 20% of your NCLEX. So don't worry, we have a playlist on HETV that literally is called Management of Care, and I cover every issue that I just mentioned, okay? Now, the next category on the Ngn Nclex test plan is safety and infectious diseases. And there's more of a focus on the infectious disease than the safety. What I mean by that is you really go deep into infectious diseases. Proper PPE, how to put it on, how to take it off, what order to remove it, what order to put it on, personal protective equipment. I had a brain fart for a minute. You have to know more about diseases than just the actual precautions. For example, if you thought all you had to do was memorize Spider-Man and you got it, no. Yes, you do have to know contact, droplet, airborne, standard, protective precautions. All 5 of those columns of precautions are your responsibility, but you kind of also have to know something about the disease. Some really common diseases that you better know and know really well include TB, measles, mumps, rubella, varicella. Yeah, flu. Hello. Of course you have to know flu, pneumonia, and even COVID. Okay, so you have to know these diseases, but don't blow off all the diarrheas. Shigella, giardiasis, cholera, rotavirus, norovirus. All these diarrheas, hepatitis A and E, they're huge on your test. And so you have to kind of know a lot about infectious diseases. Now, when we look at the safety aspects of infectious diseases, we're really talking about things like restraints and, making sure that during some of these procedures that we're doing and different surgical things we're doing to patients that they remain safe. Examples of that include timeout procedures during surgery. The next category is the one that I have yet. Are you listening? Are you really listening? Are you paying attention? Like, for real. I have yet to find the student who knows what the hell health promotion and maintenance is. Oh, yeah, once again, we're talking German, and the explanation on the actual report doesn't make any sense at all. So let me break it on down for you. It is simply maternity, pediatrics, growth and development, geriatrics, or the elderly patient over 65 years old, as well as the issue of vaccines, cancer screenings, your real ability to understand risk factors and the proper screenings that go with it. So I hope that helped, because this one is ridiculously misunderstood. So you got your 20% for management of care. 15% of your test is infectious diseases. I mentioned that they went up on that category. Health promotion and maintenance is about 10%, about. Okay. The next one, boy, oh boy, oh boy. It says here that psych is about 10%. That's true, sort of. The problem with psych is there's a tremendous amount of diseases and medications. Obviously, they go together, disease process and medications, for the psychiatric category. So what I tell my students is most of the medications on NCLEX come from the psych patient, okay? So you really have to make sure that you combine your knowledge of psych with psych medications. And we even have a special packet called Psych Meds because this is so important. And another thing that we noticed in my talking to students all over this world is that if you were not born in America, in the United States, you do poorly in psych, and often this is one of the major failure areas for you when you take the test, because the understanding of psychology is not black or white, it's rather gray, and it's also imperfect. And the things we do here in America, you might never consider doing in your home country, your country that you were born in. So I would say to you, if you were born outside the United States, that psych is a special focus area for you to really understand. And if you failed it, don't worry, we have some tools for you to kind of get yourself together with psych, because it is confusing for people not born in the US, okay? Basic care and comfort. Remember how I said upon evaluation of all these years of the old test, and you remember that the test changes every 3 years, and then we went longer than that for this new test. And then when they came out, they completely changed the whole test. I think for the better. I really think the new test is easier, just my opinion. Probably because they give you partial credit and the case studies. You guys seem to love the case studies. I often say don't study for the case studies because you already love them. You already know them and you're already doing well in them. Study this basic crap, right? So like I said, basic care and comfort has been the highest area of failure on the old test forever, as long as I've been doing students, which is over 20 years, and you know, there's that. So for basic care and comfort, so many people don't understand anything about basic care and comfort. So I'm going to give you some tips, and obviously I have a playlist dedicated to basic care and comfort, like what all you just got to know. It's diets and nutrition. It's a lot of teaching. It's ambulation and positioning. It is your basic care, like mouth care, hygiene. It's also adaptive devices, crutches, canes, walkers, and things like that. It's actually even your post-mortem care. Like, what are you going to do with this patient when they die on your shift? It is your patient sleep cycle. So what do you do to help your patients sleep? Like, how do you encourage sleep? Do you even get enough sleep? Because if you're in nursing school or you're trying to pass this NCLEX, probably not. Yeah. Okay, so that's your basic care and comfort. Even your patient's stool pattern, urination, all that crap. I'll give you some examples: coughing and deep breathing. Another big deal to remember with basic care and comfort is two really good examples here. If I'm your patient and I tell you that I'm constipated and you say, oh, hold on, I think the doctor's ordered you a stool softener. You failed that question. Yeah, you were supposed to say something along the lines of, okay, well, we're going to increase your fluids, make sure you're drinking enough, like really, really hydrate. And then I really want you to get up and move around a little bit, because we know that moving actually helps your bowels move, right? And then you should be saying something along the lines of, I'm going to see if you can't get a little bit more salad and greens in your diet for your dinner, because you need a high fiber diet. And you need foods that are going to help you, you know, move your bowels. So that's the key. So another example, if I complained to my nurse and said, oh, this heartburn is killing me. And you said, well, let me go grab an antacid. No, not so much. You failed. You should have said, well, I want you to try staying away from fried, spicy foods, not laying down right after eating, and making sure like you don't have like tight clothes on that make you uncomfortable, and try not to eat too fast, really slowly digest, you know, slow down digestion. One of the things we do as busy people is eat in a car. Yeah, that's a heartburn ceremony there. Okay, so if you're seeing the common theme here, the common theme is you are not a doctor, you are not a pharmacist. So act like a nurse, do your teaching, because that's what we do best. We're not supposed to be like throwing drugs at the condition. We're supposed to find teaching and normal things, processes to eliminate or prevent the condition. Hope that helped, because that was like a big failure area. And don't get it twisted, it's still a big failure area for the new test. It's just tied by another category. Okay, now let's move on. Pharmacology. Well, I already told you that there's more pharmacology on this Ngn Nclex test plan. By design, I mean, it's not lost on the National Council of State Boards of Nursing that we had this huge national case with the nurse, Redonda DeVault, who didn't even know the name of her generic meds, which is why the patient died. In other words, remember what the story was about. Redonda DeVault was a nurse, and she was working at a hospital, already had been a nurse for 3 years. She was ordered by a physician during a diagnostic test of her patient to give the patient 2 milligrams of Versed. She went to the Pyxis, did not know the generic name for Versed. In their Pyxis, like ours, the Pyxis is all generic names. She put in VE or she actually put Versed in, didn't get anything, and then she put VE in. I followed the case, can you tell? I had my students follow the case. It was a fascinating case. A lot of rumors about it that aren't true, but it was a fascinating case. So she put VE into the Pyxis, and she got vecuronium, a paralytic agent that killed the patient. Also a drug we've used for capital punishment in the past. So that should tell you how fast that patient died. Okay. Now, because of that whole scenario, you better know your pharmacology and you better know it well. I have seen students who said they got 30, 40, 50 drugs on one test. So I need you to really know your pharmacology, especially your generic names. The test is all generic names. You know that. So there's never going to be Tylenol on there. It'd be acetaminophen. And there sure as hell isn't Lasix. It's furosemide, and there's no Bumex, it's bumetanide. So really know your meds, but here's a treat I hope you like. Never study math. No. Here's what your nursing school and your nursing instructors didn't tell you and should have, but they may not even know themselves. Math is not a major part of the test. Number one, most people don't get any questions at all. But more importantly, in the test plan itself, it says that math cannot make you pass and certainly cannot cause you to fail. Well, if you can't make me pass or help me fail, then I ain't doing it. That's called the Shelly logic, because I don't waste time on shit that I don't need to do. Now, don't get it twisted. When you leave that test and you pass, because you're going to, remember that you better study your math, because your hospitals are still giving math tests the first week of your new job. That was a little hint for free. Yeah, so, but for this test, stop it. Don't get all spastic about math. You don't have to know it. And if I'm really honest, like really honest, I am 60 years old and I haven't done a math question yet on NCLEX. And I'm sorry, not NCLEX, in the real world of nursing. Yeah, what's that about? Yeah, see, I know, and hospitals know, that they would never trust people's lives to the math skills of a nurse. So we have things called smart pumps. We have all kinds of technology available to us. We also are allowed to use a calculator and call the pharmacist. So stop. Math is overrated. No more studying math. I hope I freed your spirit and made you feel a little bit better. Next is a big, if not the number one area that I want you to really focus on: reduction of risk. Now, what do we have so far on this Ngn Nclex test plan? 20% management of care, 15% infectious diseases, 10% health promotion and maintenance, 10% of psych, 9% basic care and comfort, and a big whopping 15% for pharmacology. I told you that went up. And then with reduction of risk, we have another 15%. Now, these totals are not going to come to 100 because they're really averages and what I've seen over all these years, and specifically for the Ngn Nclex this last year and a half, okay? So when we say reduction of risk is a big whopping 15%, wow, what is it? Most people don't know. Here's what it is. It's all your procedures. Like, it's literally your eye drops, your ear drops, your sitz bath, your Foleys, your NGs, your MRIs, your CAT scans, your EEG, your EMG, your TEE, your TTE, your EKG, it's all the procedures that we do on patients. Ileostomy and colostomy. It's colonoscopy and ERCP, and it's AccuChecks and transdermals, and it's a lot. Dialysis. I mean, you know, biomechanics. It's really crazy stuff. So it's really, really important for you to brush up on all of those procedures because they ain't nothing to play with, honey. And I'm being real serious, okay? Physiologic adaptation is frankly the hardest one of all because it requires a deeper understanding of the disease process. So I like to give examples to provide clarity. So in this one, let's give you a basic physiology question. What causes cirrhosis in most patients? If you answered alcohol, you're basic, you did that shit, good for you. Now let's try physiologic adaptation on a little higher level. What causes ascites in your cirrhosis patient? Doom, 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 doom. That's the clock. I'm still waiting. You might be saying, waiting on what? I'm waiting on your answer because I know you don't have one. Well, some of you might, but most of you don't. And so let me explain. If I said what causes ascites in the cirrhosis patient, I hope that you said because of the liver's inability to metabolize protein, the patient's albumin is low, and albumin is responsible for keeping water inside the blood vessel. In addition to this, the patient has portal hypertension, and that portal hypertension is responsible for pushing fluid out of the blood vessel and into the peritoneal cavity. Yeah, I know, it's a lot. But that's why you can't just do questions. You must be prepared to watch videos. If you didn't have a good nursing school with instructors, with professors that actually taught you, instead of make you look everything up on your own or do your own work or teach yourself and you paid them. If you didn't have that kind of instructor or professor, and you certainly don't know any of what I just said, you've never even heard of any of it, there are videos for you, and I'm good, but I may not be the best. There's other people out there, but certainly my videos are very organized by playlist. So this information that I just shared with you about cirrhosis, it's in there. The next category for your Ngn Nclex test plan is called clinical judgment. This is kind of confusing to students because I see that category and they're like, well, what is that? Well, it's really your case studies, right? So watch this. The clinical judgment portion of your test for the NGN test plan is going to include all of these: recognize, analyze, prioritize, generate solution, take action, evaluate outcomes. So recognize cues, analyze cues, prioritize hypothesis, generate solutions, take action, evaluate outcomes. The first three are you thinking. The last three are you doing. Now, I will say this. I don't want you to waste too much time studying case studies. It just generally seems to be not a problem for students on this new test. On this Ngn Nclex exam, it's not been a problem. What is a problem is 8, 7, 6, 5, 4, 3, 2, 1. So sometimes we get so worked up about the new changes, we forget that you fail on the old basic requirements. Now, when we look at the components of clinical judgment and we say, okay, so then what is recognizing cues? One of the things I teach you for what is recognizing cues is that's all the numbers on your test. That's the labs, that's the vital signs, that's a person's age, that's even time frames. Let me give you an example. A 16-year-old Abruptly shows up in the emergency room, doubled over, complaining of pelvic pain. She is with her boyfriend and he is not making eye contact. So if you think about recognizing cues, 16, that was a huge cue. Abruptly showing up at the hospital, huge cue, because abrupt means a time frame. It's a recognized cues. Now, her boyfriend's with her, and that's a cue, sort of, but he's not making eye contact. That could be considered a cue, but then teenagers don't necessarily make eye contact, so it's hard to say. If you analyze cues on this scenario that I gave you, you would need to be really, really a critical thinker. You would need to understand that if they said a 16-year-old showed up with her boyfriend with, all of a sudden pelvic pain, you'd need to kind of understand, oh, wait a minute, it's a female, she's 16. Analyzing these two cues means she could be pregnant. It also means she can't give consent. It also means that you need to include Erickson in Erickson's stages of development in your care of this patient. Do you see? Okay. All right, so that was recognize and analyze. Prioritizing hypothesis would lead us down the slope with the same example of the 16-year-old young lady who showed up with her boyfriend abruptly in the ER with, doubled over with pelvic pain. We'd need to prioritize hypothesis using what we just did. And if I were prioritizing hypothesis, I would think what could kill her first, or what could hurt her or disable her, so that I need to focus on that and focus on that only. I mean, maybe she is something else on the side, but who cares? So what would I focus on in terms of this example I gave you? Well, I'd wonder if she was having an ectopic pregnancy. I would wonder if she was having appendicitis, because these things we know cause severe pelvic pain, and she's kind of in pain, okay? All right, so generating solutions. Well, I could easily generate solutions by making sure I do an accurate handoff report to the doctor. In other words, SBAR, giving accurate information. I could formulate a plan of care for nursing. I could implement precautions if I needed to. I could make sure that I watched how she is coping with the pain. I could even do a pain scale to kind of get an idea of how serious this pain is. When I am generating solutions, I can also think about what is it I could do to get myself an answer really quickly. So, in my plan of care might include a pregnancy test. Okay, now taking action. Those are things that we do sometimes right away. Sometimes they'll even say, what's your first nursing action? And these things include examples like start an IV, put the patient on oxygen, check their pulse oximetry, make sure that we not check their pulse ox, but a pulse ox that was less than 90 on oxygen. A take action might be to change the mask to a non-rebreather. Sit the patient up who's having difficulty breathing. Heimlich maneuver for somebody choking. Take action. Stop assessing, which is why I said don't put the pulse ox on. That wasn't an example. Stop assessing and take action. Evaluating outcomes. Did the action you took work, or is the patient actually getting worse? Here, we're really focused on, is the patient improving or getting better? Is the patient going to need some discharge planning regarding this admission for this problem? What's going to be the follow-up? What are we going to do with our discharge teaching? How are we going to prepare this patient for what they may need to do when they go home? Or is home not a safe place and they actually need rehab? I hope that helps. Now, we're finishing up, okay? So, if you have been listening, you know that this Ngn Nclex test plan has 9 broad categories, but 15 categories total. So 15 categories, but really only 9, because this entire section under number 9 are case studies. Okay, that entire section is a case study, all your case studies. We talked about the number of questions being 85 to 150, and I do want you to notice, if you are trying to understand your CPR report, that it does matter how many questions you failed in. If you failed in 85 questions, you knew nothing, you knew nothing, you knew nothing. It didn't take the test long to kick you right up out of there and say, bye, Felicia, you don't know shit, because on your test, you killed everybody. I cannot resuscitate them. Chest compressions will not work. I cannot bring them back to life. That's how badly you killed them. However, if you failed in 150 questions, you kind of were right on the borderline of passing, and you need to take a little bit of comfort in knowing, maybe it won't take much to get me to pass. Like, maybe there is some hope that, I can do this and turn around and get it together without a lot of, extra stuff. So, often if you failed one time in 150, you may or may not need a review course. You may need just a little extra resources to get you over the hump, and you're fine. But, on the other hand, if you failed an 85, 95, 100, if you failed all up in there, well, you probably need real help. Like, you didn't learn anything, probably because your school was a piece of crap. Okay. The categories on the candidate report are above, below, and near. And I just want to stop you right there if you got all nears, because a tendency for the all near person is to say things like, I almost failed. I almost passed. I got all nears. Yeah. Oh yeah, Dr. Shelley. I almost passed. I got all nears on my candidate report. Okay, let me help you with this. All nears sucks ass. Okay? Yeah, it sucks, because I didn't hear anything about aboves. I didn't hear anything like my one student who had all aboves, 1 near, 1 below. That girl right there, she almost passed. You failed in every subject. So what do these categories mean? Well, above means you got almost every single question in that category correct. Below means just the opposite. You got every single question in that category incorrect. Yeah, let that sink in. Like, incorrect, like you missed most of the questions in that category. So then what does near mean? Near means that when they kept it really basic, you got those answers correct. But when they increased the difficulty, you were like, what the fuck is this? I don't know what this is. Bye, Felicia. I'm leaving this test. I don't know what any of this is. So basic, you were fine. Increase the difficulty, you missed those questions. And that's why you're here listening to me. And that's okay, because I'm going to show you how we can do this. Now, I do tell my students to count the number of belows. Yeah, go ahead. Count them. When you count the number of belows, if you missed 2, if you got 3, let me say this. If you got 3 or more belows, you need extra help. Hello, you probably knew that. If you have no aboves, you need extra help. You probably knew that. Anybody else with nears and aboves and, 1 or 2 belows, you probably need just a little bit of something, right? No real full-on class unless you failed in 85 questions. So what kind of help do we have out there? Well, most of you know it. So let's say that you got 5 belows, failed in 85 questions. You need everything. You need a class. You might even need a self-study program if you're nowhere around me, and that's really, really hard. And so let me show you what we have that might help, might not. So here we go. I'm being dingy. Let me just show it to you because Lord knows I don't know what I'm doing with technology. But anyway, if you really, 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 really failed and had all of those, shall we say, belows, cardio, respiratory, renal, acid base, neuro, GI, right? Diabetes, endocrine, cancer, hematology, right? Immunology, and then the specialty areas, you know, that health promotion and maintenance, your psych, your geriatrics, your maternity, your pediatrics, your growth and development, even pre-op. Those are usually what we see that you actually need because that is all of the subjects. Now, that's called a self-study. Some people don't need all that. Some people only need pink packets. You know what pink packets are, but just in case you don't, let's review what the pink packets are, shall we? Some of you know these by heart. We told you that your test is management of care, infectious disease, psych, pharm, reduction of risk. Management of care, infectious diseases, psych, pharmacology, procedures, reduction of risk, EKGs, and then the most famous guide of all, the Oh My God, because it has so much of the basic care and comfort right in there. These are called pink packets. Whatever you need, we have for you. If you need a lot of help, we even have a 3-day boot camp coming up in May and another one in July. But if you don't know what you need and you need a consult because you're clueless about what you need, you can reach me at 216-410-0936. Text, please, because you already know I'm never going to answer that phone. I'm just too busy. When I leave here, I intend to go answer all of those messages from the last God knows how many couple days and help those students. So I don't have time to answer the phone. I do well with text messaging. God bless you. Deuces. I really, really hope this helped. Oh, let me tell you something. I forgot to tell you something. So if you are someone who did fail, this is just for you, a little add-on to this video. Let me make you happy, okay? Let me help you. Yesterday, we had a big, huge annual celebration of nurses. In that ceremony, I literally, Shelly's Nursing Review, I literally awarded with money these distinctions, awards of distinctions to about 20 nurses. 18 of them failed. 10 of them failed more than once. 4 of them failed more than 4 times. They were honored last night for being the best nurses in the world. You got this. Don't give up.